My name is Djuro Petkovic. I'm a shoulder, elbow, and sports medicine specialist at Illinois Bone and Joint, and I've been with the group since 2017. My approach with all patients is always to first figure out what their goals are. And that way I could see whether they're a person that's really looking for something that's more conservative or whether they have a time constraint that they need to get a problem taken care of quickly. That allows me to customize the approach. For instance, if I have a young throwing athlete and there's a time constraint on their season, you could either go conservative or surgical, but if we go conservative and they lose a season, that's a big deal for them. On the other hand, many older patients who've had chronic problems, they've been dealing with these for years, so we really hit the conservative treatment a lot more. Patients didn't come to see me just as a friendly visit. They're there for a problem. They're always trying to help people have a better day than what they started with. So I always give it my best to try to achieve that goal, whether that be in a clinic visit or whether that be in a surgery. Every job gets done and every job takes as much time as that patient requires. And that brings me satisfaction to know that I've given my best and I've made a positive impact in that patient's life, and I continue that with each patient I see. I think IBJI gives each practitioner a lot of flexibility to tailor their practice according to how they see fit. There's really no micromanaging of how we do this. Just like every patient is different, every doctor is different, and they allow that flexibility